Welcome to Building Blocks Week 3. I'm Luke Wheeland with the ARC Arapahoe in Douglas County here outside of Denver, Colorado. We're going to go over entry into the system today. We're going to talk about a handful of options like single entry points, what they are, community center boards, what case managers do, some early periodic screening and diagnostic and treatment, or EPSDT. The wait list for IDD services, if there are any, and what they look, the one that there is, what it looks like. Health insurance mandate for autism treatment, or HIMAT, here in the state of Colorado. And if there's time, we'll discuss the Wrightslaw. Again, this is week 3 of building blocks, the kindergarten roughly through about 14, 15, 16-year-old age, talking about the child systems for the state of Colorado for people with intellectual and developmental disabilities. This is being recorded in the fall of 2020. So we'll just get right into it tonight. First, a little recap from a few evenings ago, a crash course on Medicaid. So we at the ARC, we think of Medicaid like a house. There are many ways to get into the house, through the front door, the back door, window, all those different ways you can get into someone's home. So we're really working on trying to get you, your loved one, or your family into Medicaid. If that's by your family qualifies due to the financial requirements, or your loved one, you can buy into Medicaid. So we talked about the buy-in program last week. We really want to try and figure out how to get your loved one into Medicaid, because having Medicaid is a really big deal here in the state of Colorado for someone with an intellectual or developmental disability. There's a lot of things that benefits that help your family down the road, help you down the road, help them down the road. So remember, Medicaid is not Medicare. These are two very distinct programs, and we focus on Medicaid, and Medicaid is really what helps people with intellectual and developmental disabilities from birth to death. Medicare helps people as they get older with some medical things, but not necessarily people with disabilities all the time have to have it. So then we break down the waivers, which we'll do next week, of actually the child and child waivers. And there are different rooms in that house. So how do we get into that room? Has different locks and keys and ways to get in and out of it. So again, recap from last week. Here's Medicaid. This Health First Colorado, or what we call it, or Medicaid. So you got to think of everything to the left of the screen in the box or diamonds are what's everyone gets in Medicaid. If you're qualified for Medicaid, you're eligible for almost all of these services. Now there's some caveats to each of them that you might have to, but everyone gets primary care physicians or doctors, can see specialists if they need it. Go to the hospital. Down there in the kind of the teal color, you'll see EPSDT for children from birth to 20. We'll talk about that in a little bit. But that's the medical side. So everyone gets the medical side of that if you're qualified for Medicaid. Then your loved one, if they have an intellectual or developmental disability, we're going to see if they would qualify for the waiver side also. So they get the medical side, but we can also get them into the home and community-based waiver services. And so that's the green and blue stop sign hexagons. If you see the green are the child waivers here in the state of Colorado, and we'll talk about those a little bit more next week, and what they look like and what all the criteria are for them. Excuse me. So start off single entry points. We got to get you into the system. And where do you do that? You go to a single entry point. So we call them SEPs, or single entry points, here in Colorado. And you can see the rundown of the waivers that are offered. There's the Children's HCBS waiver, kind of a waiver, kind of not. There's the Children's Extensive Supports waiver with an asterisk, which is specially designed for kids with intellectual and developmental disabilities. Children with life-limiting illness, Children's Rehabilitation Residential Program Waiver, CHIRP, or HRP. It's typically run by the county with a lot of CCB support, and that's slowly being transferred. There's the brain injury. This is just up into the adult world. Elderly, blind, disabled in the adult world. Supported living services in the adult world. The developmental disabilities waiver, mental health waiver. There's also a spinal cord waiver that we don't typically list here, but that's a single entry point. So single entry points are the way we get in the door. They're the ones that control people how they get onto a waiver. So single entry points provide case management, care planning, and make referrals to other resources within Health First Colorado or Colorado Medicaid program. So single entry points are across the state of Colorado. They're kind of governed by different regions. They're contracted by the state, so they have to bid, and they change every few years depending on who wins certain bids. For single entry points govern different waivers in different ways. So not all of them work with all the waivers. Some only work with certain ones, and they might refer you to a different single entry point or version of that, which we in the disability world call community-centered boards, or CCBs. So right now for Arapahoe, Douglas, Elbert, Denver, and Adams County, our single entry point is Rocky Mountain Human Services. They are also the community center board for the Denver County. So they kind of run two handles there for us, but single entry points provide that case management to get people into a certain waiver. So if you're in the child waivers, there's 3 of them that are run by a single entry point, so you'd go to Rocky Mountain. Then there's 1 that's run by a community center board, and if you're in Arapahoe and Douglas County, our community center board is Developmental Pathways. So this is what a community center board does. They're essentially similar to a single entry point, but they only work with people with intellectual and developmental disabilities. So they help get people into intake. They do eligibility determination, service plan development. So that's where we're planning for what services and providers help your loved ones. They arrange for services, meaning they kind of figure out hours, total hours of the week, how many, days of the week or how many times a year you're going to get a service. They help with, they do some delivery of the service of getting providers set up to come actually do the service. They do services and support, so they coordination, so they make sure that everyone's doing what they're supposed to be doing, that they're working out the hours. They kind of figure out how much money we have to spend per individual and how we distribute that across that. They do some monitoring, some safeguards. They help with a lot of paperwork, and then the case management activity. So a lot of what the community center boards are doing is the paperwork. They are not doing direct care. They are not the ones coming out to help you with your loved one for respite or helping them get, out in the community to do things, or cleaning your home, or doing any, medical care for your loved one. They are doing the paperwork to show that they're eligible and that they qualify for services, helping connect you with providers, and then providing that ongoing case management to make sure services and supports are going the right way, monitoring, make sure everyone's following the rules and things are working well. That's what a community center board does. So again, they are a gatekeeper to Medicaid. You have Medicaid, so cool, we're in the house, we got your Medicaid. Now let's go try and get into one of these rooms through either a single entry point or the community center board, and we can get you enrolled into a waiver, and they'll figure out if your loved one is eligible for that. They do that with case management. So case management is the assistance provided by a case management agency on behalf of someone that's eligible for that waiver resource, essentially under that Medicaid program or Health First Colorado. Case manager is responsible for, assessing the long-term needs of your loved one. So they go through some assessments they run through with you, and there's different ones for different waivers or different rooms in the house we're looking at. They develop a care plan or a service plan, as we call it, for each of your loved one, and that should be very person-centered around what their needs are. They coordinate and monitor the delivery of those services. So if you have a provider that comes out and does things like respite or community connections or certain medical things for your loved one, that case manager, depending on if it's with a single entry point, home health agency, or maybe a community center board, they're going to be doing that coordination and monitoring. They're evaluating the effectiveness and essentially the use of those services, along with reassessing or revising the service plan. So if we're having 20 hours of respite a week and then we need more, and there's still money there, they can essentially move some things around and reallocate some funds and give your loved one more respite hours. So case manager, again, is not the provider. They're not doing any direct care. They are the ones providing services to get you in touch and in communicado with those providers. Also making sure they're doing all the paperwork, checking all the boxes, and getting everything run through the Medicaid system to make sure everything's on the up and up and we're, okay and you're approved for services. But case managers are very important in your loved one's life. You're going to have to talk to them quite a bit and tell them your story, and you might have to tell them a few times because they might move or get promoted, or the system was always kind of ebb and flow with case management. But they are very important to get your loved one the services they need. I always refer to case managers as kind of like a stockbroker. They don't ever touch the Medicaid dollars your loved one's eligible for in person. They essentially move money from one account, Medicaid, into these other accounts set up as providers. So the providers would be like Luke Wieland Agency, Blue Water Bottle Agency, Light Agency, and they provide different services. Those providers now get to bill against those accounts, essentially, and get paid for the services they provide your loved one. So your case manager is moving money from one account over here to multiple accounts over here on a yearly basis. So every year that resets, and you sit down and talk about how you want them to move, the total money from Medicaid to these other accounts, so your loved one can get services which are provided by direct care staff. So or in and around the Denver metro area, here's the main contact information. So calling Rocky Mountain Human Services as our single entry point is a great place to start. They can talk to you a little bit more, or call in an ARC, a little bit more about Medicaid, what you need, can line you up with some services and supports around what those look like, and like what paperwork you need to get involved with to make sure we can start enrollment processes depending on what single entry point you might be what waiver we might be looking at. There's the county, so you can also call your county directly and have a conversation of what might help with them and what might not, depending on what your needs are. Or you can go directly to your local community center board here in the Denver area. There's the four main ones in Arapahoe, Douglas, Adams, Jeffco, and Denver counties. But the idea is you have these counties here, you have these individuals that they can help you, and they can essentially work with you pretty well on getting you organized so we can start the enrollment or intake process for a waiver if your loved one's eligible for that waiver. They will also talk with you about the other things you might need to go get before we look at getting you into a waiver. So they're going to help you figure out how to get into that house, so get into Medicaid. So they're going to tell you, well, we need you to apply for Medicaid. They might give you some documentation around what you need to go look for to make sure when you apply. It could be from your community center board or your single entry point. They're going to try and give you all the stuff that you might need to go get to get you into the Medicaid house per se. And once you're in the house, they're going to see which rooms in that house you're available to work with. So do we have any questions? I'm going to go ahead and pause the recording for a moment. Okay, we're back. Again, this is recorded in the fall of 2020. So as we talked about a little bit earlier tonight, the basic setup is, we got to get you into the system. We got to get you, your loved one, as we talked about last week, Medicaid. Once we have Medicaid, or we can buy into Medicaid to get you some supports, then we can work on what else we can get. This is a program within Medicaid, so it's not a waiver, so it's not its own room within Medicaid. It's just kind of part of, everyone has access to it. It's like the living room of the house. That if you're between the ages of 0 and 20, your loved one's eligible for EPSDT, or early periodic screening, diagnostic, and treatment. This is where they're getting a lot of their health checks done for age-appropriate intervals. These are where they're getting screenings for mental, developmental, hearing, vision screenings to make sure they're hitting those milestones, and if they're not, what we might need to be put in place, if maybe speech or OT-PT, or if they might have a developmental or intellectual disability. This is where those testings are being done. They're doing a lot of diagnostic testings to follow up if there's a risk, if there's something identified in one of those periodic checks or screening. You're going to get that diagnostic done to kind of start honing in on what that might be and ways we can support you and your loved one. And then there's treatment. So that's the control, like the reduce the health problem. So treatment, it's treatment. So it could be behavioral, it could be treatment. This is where like ABA or BCBA lives. in in the Medicaid system for kids, anyone under the age of 20. It could be straight on medical treatment of getting something, a referral to have a procedure done, or medications, or whatever that might be, or PT or OT or speech. That's where that treatment part comes out of it. So again, the EPSDT is very important, and so that's why having Medicaid, it gets your loved one to start getting a lot of these things done on a regular basis that your private insurance can do also. But having Medicaid gives you that little bit extra bonus to that. And so who qualifies? Again, we talked about that 0 to 20. It's made for screening diagnostics. It's provided under the Colorado Medicaid program. And it includes people who adults who are pregnant, so they get EPSDT services around their pregnancy. There's age appropriate screenings for your loved one, so your kiddo can get those age appropriate screenings if you have insurance and your insurance covers it. Great. If not, you have it and they don't cover some of those screenings. EPSDT can if you have that dual enrollment into Medicaid. And again, they provide and the provisions for the screening, so they'll actually help arrange those through referrals and help you connect with that. So again, getting to Medicaid gives you a different case manager to help you kind of navigate some of that EPSDT stuff, so you can get those screenings. And again, this is where behavioral health lives for kids under the age of 20. So AP, behavioral therapy, that's really important to getting kiddos with some behavioral struggles or challenges or they just need to talk through some emotional development. That EPSDT is where they would go for that. The biggest thing for EPSDT is it has to be medical necessary. So Medicaid has to cover certain things. So services must be provided even if the service is not available under like a state plan or Medicaid or other Medicaid ideas. So Medicaid is determined through this. So EPSDT might have some things around, like your loved one is diagnosed with a special diagnosis, they need this treatment. Medicaid doesn't necessarily provide that for everybody under Medicaid, but for your kiddo, because they're in Medicaid and accessing it through EPSDT, they can essentially get that service. And then there's also some of those things that, like those non-arbitrary limitations on services, like your primary insurance might say you only can get one pair of glasses a year and there's still a high deductible. Well, under EPSDT, that's something that they can essentially say, oh, we can get you more. If your kid breaks their glasses a lot, they can get more. Or you only get 4 physical therapy appointments a year, or 10. EPSDT can essentially up that limit. That your private insurance covers X amount, Medicaid will cover Y amount, then EPSDT can push that above that to give your loved one a little bit more support in that system. There's the main benefit of it is you're getting a lot of those comprehensive health development screenings for your loved one, and they're doing a lot of tests and lab things, and so that we can make sure we can kind of figure out all the puzzle your loved one might have, so we can help them the best we can. Especially as they develop and get older, the more we know as they're younger, the better we can start things to maybe help make things not as extreme as we get older. There's some more benefits and things continued here. You're welcome to read through those, but things like dental, vision, that you might have to pay out of pocket on top of your primary insurance. Well, you might not have to do that for your kiddo, because they can get those basic dental and vision needs through EPSDT if they have Medicaid, or if the whole family does. Here's more about the diagnostic treatment screenings and the treatment itself. So again, behavioral therapies is really the big one under EPSDT that people with disabilities, intellectual and developmental disabilities, use in that EPSDT screening, because that's where it is. So you don't have to qualify for a waiver program. You have to have, your loved one needs to get into Medicaid, so however we can get them in that house, but then they can get behavioral therapy. So if your son or daughter has autism or other diagnoses that have some challenging behaviors at times, at ABA therapy, or there's different kind of behavioral therapies that are really beneficial as the younger we can get them started for the long haul. EPSDT can do that without having us to be in this, oh, well, now we have to qualify for a waiver too. Nope. Once you're in Medicaid, we can start EPSDT services and start with behavioral therapies and things. It doesn't include anything that's experimental or investigational though. Like that is one thing that doesn't. So things like ABA was like 10 or 15 years ago, but now it's not. So just, there are some things out there that are still experimental, or they don't have enough data behind them or enough scientific push behind them yet to say that they're very meaningful. And they might be meaningful, they might be amazing. They're just not there yet. But they do, do a lot of things to help with that. And they're always broadening, adding things that EPSDT can cover. They don't essentially do any real direct services other than PT or OT or speech and stuff, and but they're not out there doing respite or home health support or home modifications. Examples, those are waiver services, or those in-home or home health support's another part of the Medicaid state model, so that your loved one can be approved for. But it's not necessarily that they are the ones that are getting, people coming out and helping you in your home. They're doing essentially medical or behavioral treatment things under this program. Okay, so wait lists. Luckily, currently in the state of Colorado, we only have one wait list. We would like to have any, and we keep working on that. But currently, there are no wait lists for any of the waivers below. The Children's HCPS, the CES for kids, CLI, the CHIRP waiver, and then the adult waivers, the brain injury, elderly, blind, disabled, supported living services, mental health, or spinal injury waiver. None of those currently have any wait lists. They're open enrollment. So once you have Medicaid, we can go to the single entry point, be it Rocky Mountain Human Services for Denver, or maybe Development Pathways if we're looking at the CES waiver, so Children's Extensive Services, or go through any single entry point, and they'll give you here's your options, and then they might give you the contact of where you go apply for that waiver. But then we have to get your son or daughter to qualify, and we'll talk about what those qualifications look like next week. So the idea is we have enough supports in place that we can get your loved ones into a waiver if they qualify. And luckily there's no wait for those. The long wait really is just getting all the intake and enrollment paperwork done, and getting you and the case manager to follow through and follow up on all the things that need to be done to get someone enrolled. Currently, there is only one wait list in the state of Colorado. That's for the adult developmental disabilities waiver. And we at the Arch continue to work on hopefully ending that wait list sooner rather than later. There is no guarantee that all these waivers would never go back onto a wait list. We at the Arch would definitely highly try and discourage the state to do that. But again, it is a budgetary system. So, but luckily right now, and even going into the 2021 budget system, none of these have been earmarked to start a wait list again. So if it's, well, there's such a long list, wait, we'll never get into services. It's not true. Let's talk with an ARC advocate, talk with someone over at a single entry point or a community center board, and let's start the process of looking at how do we get you into Medicaid? How do we figure out how your loved one might qualify for Medicaid? And once we're there, then let's see if they qualify for a waiver and what waiver might be best suited for them. So again, next week we go through the whole list and some diagrams of showing you kind of how that looks and maybe how to make some choices around waivers. There is, since we like to be confusing in the system, there is one wait list that we want your son or daughter to be on, and that is the wait list for adult services. If that's one of the only things you take away from this training, please make sure you've reached out to the community center board within your catchment area, wherever you are in the state of Colorado, that your son or daughter at the age of 14, if they have an intellectual or developmental disability, have been placed on the adult wait list, meaning that when they turn 18, you should start getting contact information from that community center board. For us, it's Developmental Pathways, reaching out to you to start the intake and enrollment process around, hey, your son or daughter has an intellectual and developmental disability. They may not have qualified for Medicaid before they were 18, or qualified for a waiver. They might just not have had a severe needs. As we talk about next week, waivers are based on severity of need. But at 18, they become their own adults. So, then their Medicaid, qualifying for Medicaid is on them. And if they don't have an income or very low income, they would probably qualify for Medicaid more than likely on their own. They have an intellectual developmental diagnosis, then they would also essentially meet the criteria for being into a waiver. So we got them in the house, remember? Now we can get them into one of those waiver rooms within that house. So reaching out to that community center board and just making sure that they have your contact information, that you're in connection with them. There's also a lot of things a community center board does outside the waivers. So say your family don't qualify for Medicaid, or they do, but then they don't qualify for a waiver service. There are other supports within each community center board called family support as a program, or community outreach is what Developmental Pathways currently calls theirs. There's mill levy money or tax dollars within each county that, some counties have it and some don't, that help, but they go towards paying for supports above and beyond waivers, or paying for supports that feed families that don't qualify for a waiver. But again, so having communication with your local community center board is a very big deal, and it might allow you access to some funding for your loved one, even if you don't necessarily maybe qualify for straight Medicaid or qualify straight for a waiver, but also making sure that you stay in contact so we can get your loved one on that wait list at the age of 14 is really important. These are a little bit of old numbers, but this is the wait list from the last time I could pull them from around the country. So, it shows different states, and some states have 0, like New York. Sadly, there's still some institutions in New York, so they don't necessarily qualify for that wait list. But if you look at Colorado, our wait list from a few years ago was at 3194. It's roughly right around that same number now in 2020. And those are all adults waiting for that developmental disabilities waiver. The nice thing that Colorado does have going for it is, even though we have a 3,000 person wait list, people aren't waiting with nothing. In some of these other states, they're only getting Medicaid. That's all they're getting. They don't get any of the waivers because their waivers have waiting lists. And so some of these states, like 200,000 in Texas, 73,000 in Louisiana. Louisiana, this is old enough that their wait list has dropped considerably because they've done some things to try and help mitigate this people waiting for supports. But here in Colorado, for kiddos in particular, there is no wait list. So let's get your kiddos, enrolled if they can qualify. And we'll go over all the qualifications for all the child waivers next week. Here's again the intake phone numbers for the community center boards. So we can make sure you're getting in and getting on that wait list from 14 and on, so that at 18 they get at least offered or get to see if we're eligible for an adult waiver program. Again, Arapahoe County and Douglas County is served by Developmental Pathways, but also they're a great place to reach out just to see what other supports they're able to offer. And even if they're not able to get into, say, a waiver, that's the best scenario, because there's a lot of money there that we can help your loved one with, or in their family support program, or they can only give you maybe a little dollars here and there from some mill levy because you live in Arapahoe County. Developmental Pathways and a lot of these other community center boards do a lot of great programs like the ARCs do, so that you can still participate in, that you don't have to necessarily always be getting money from them to be able to go to their trick-or-treat events when we're not during the COVID pandemic and things like that. So being in communicado with those entities is a great thing. Also with your local ARC chapter, just in case something comes up with schools, we'll talk about in 2 weeks, or a waiver issue, or anything else that you might need maybe some help or guidance or education on from, the ARCs are always here for you. So we'll go ahead and pause it again, and we'll go into if there's any questions. So I'm back. Didn't seem like there were any questions that pertain to the group. So we'll just keep moving on through the night. Doing pretty well on time tonight. So we're going to go into HIMAT, so our health insurance mandate autism treatment. So HIMAT's a great program here in the state of Colorado. There's the law itself. Essentially, it says that any private group health insurance that is a Colorado-based health insurance provider has to provide autism treatment, which is behavior or ABA services, behavioral therapies. And I'll explain to you how you know if they're a Colorado-based insurer. Because again, last week we talked about how insurance companies or your employer or whoever is paying for your insurance, or you're buying into insurance with them, can buy insurance based on different access points. So in different states, depending on where they want to buy it from. But if they're buying it and it's a Colorado-based insurer, they have to follow the HIMAT law. So meaning anybody, you don't have to have Medicaid, you don't have to be in a waiver, you just have to have Colorado-based insurance. And your loved one 0 to 8 gets $34,000 a year, or access to it. They don't get it, we don't give it to them, but they have access so they can help pay for behavioral services. So again, if your insurance company is locally here in Colorado and you get a certain amount of, and then everything else might be out of pocket, if they're a local one, they have to follow ABA laws. So from 9 to 18, it's a little bit less, like $12,000 a year. But again, that's a lot of money that can help pay for ABA or behavioral services that might help stop some of those or change some of those challenging behaviors. Because the sooner we can kind of help navigate that now when they're kids, the less likely that we'll have as much of a challenging behavior issues as they become adults. So we really want to work with your loved ones now and help them out and help them find other strategies to communicate or let out steam or express their feelings now, so that when they're adults we can do that so in a little bit more manageable way. Who's covered? So again, you have to be under the age of 18 with certain private insurance, essentially through the state of Colorado. Again, you do not have to have Medicaid to use HIMAT. And then you have to have some kind of autism diagnosis. Some of these we don't really use as much anymore, but those were the ones when this law was first written. And I'll go into showing you how you find out if your private insurance is Colorado based. So this is my former insurance card, so please don't steal my identity here, but most of it's blacked out anyway. So the component of this is if you look at the first, sorry, wrong thing. I thought it popped out on me wrong. The health care card on the left-hand side. This card is just a basic one I pulled off the internet, and it has some numbers in the corner. Those numbers are different than the ones on the right-hand side that say CO, so dash DOI, then some numbers. So the Colorado Department of Insurance is what Colorado DOI is. So that Colorado Department of Insurance shows that it's a Colorado-based insurance program. So United Healthcare, the one that the ARCs, we partner with Thrift to buy our health insurance. That health insurance is essentially bought through an insurance wing of United Healthcare here in Colorado, meaning they follow Colorado health insurance laws, meaning we could access HIMAT. So your insurance card should say Colorado Department of Health Insurance if they are buying it here out of the state of Colorado. A lot of programs, a lot of the health insurance agencies are, like I know Anthem, depending on if they buy it from here, can be Kaiser Permanente is, Blue Cross Blue Shield has been, United Healthcare. So it just depends on which program you are actually buying, your insurance company's buying, and they're buying into. I use the example of like someplace like Target. Their headquarters is in Minneapolis, Minnesota. So they more than likely buy their insurance in Minnesota. That'd be, understandably an assumption to make. They then have to follow Minnesota health insurance laws, which doesn't mean they matter here at all in the state of Colorado if the person's working at the Target of I-25 in Arapahoe. But what it is then that person, if they have a loved one with autism, sadly, can only get a certain amount that the insurance provides. They don't have to, that insurance company doesn't have to follow HIMAT. You can also call your HR rep or your insurance liaison, if your company has that, ours does, and ask them, like, well, what does my insurance cover? Is it based here in Colorado? And what that looks like. And if it is, then you can start talking to them about HIMAT. And if they don't know what it is, they need to go get some education on it, because you can start utilizing it. And it'd be great to get your loved ones that behavioral treatment they need. So the final thing tonight, since we have time, is Wrightslaw. So I threw this in here only because there's not really another place in the system of the trainings to do this on the online training version. So we're going to step away from waivers and Medicaid and how to get into services in the state of Colorado and kind of change gears for a second into how to get you all as parents better educated around the idea in special education laws. So Dr. Wright is a great, him and his wife are great individuals that do a lot of work in essentially teaching providers, teaching educators, teaching advocates, attorneys, parents, individuals with disabilities, the rights around special education law and how to actively advocate for that child with a disability in the school setting. There's a website here, which I'm going to go ahead and stop sharing that. There it is. Sorry, I had it pulled up. Must have closed it. Share my screen again. Thanks for bearing with me. This is the Wrightslaw page. So it's just www.wrightslaw.com. This is a wealth of information. The page is not flashy. It's not like over the top, but it is a wealth of information. Up at the top part of the screen here, there's a new now COVID-19 page that links and talks about how COVID-19 and remote learning might impact IDEA and those things. There's legal, if you need some legal advice or legal, kind of want to read up on that. There's advocacy, and there's the topics that range from A to Z. You can buy their books or watch their videos here. On the left-hand side is essentially the navigation part of this. So you can look at like things like if you are in the military, they'll offer their books at a discount. You can buy in bulk, which we of the ARCs can do at times. They have their newsletter, which is a great thing to sign up for because it kind of keeps you up to date on different things, especially right now during COVID, on like the special education in the COVID-19 era. Resource came out in their newsletter. It was a really great read, and we passed it around to a lot of families. Advocacy rule 1, like write things down when they happen. So, like we talked about last week, if everything from now on needs to be in writing, from a teacher, from a nurse, from a doctor, from a case manager at Developmental Pathways or your single entry point, from a provider, from the ARCs, everything needs to be in writing or it never happened. So moving forward, that's lesson 2. It's beyond that wait list at 14, and 2 is, getting everything is written down. How to document a problem, request a meeting. How to not be adversarial in a meeting, but still be very poignant and be very on advocacy for your loved one. They do a podcast. I haven't listened to any of them recently, but they heard they do them pretty well. But there's a whole wealth of knowledge here, so you can go into like the topics of advocacy, ADHD, what due process looks like, FAPE, so or homeless children, and our idea itself, and what came out in 2004, and what's been going on since. This is Dr. Wright and Pam Wright. So they show all these stuff on here, and this website's really, really good for you as a loved one to start navigating, start clicking on, kind of reading up on. It's essentially where a lot of times as ARC advocates, we might go to look into things and again, look things up. It is a resource we've used on an often basis. So, and essentially what we're looking for. There are tabs here you can search by your own state. So you can actually type in like, what state, and it'll bring you to the state's criteria for the state of Colorado. Or this, if you're not listening, if you're watching this from a different state, the state of where you're at. Here are their books. They're great. The All About IEPs is a great one. It kind of is what to and what not to do on a regular basis. There's the yellow pages for kids with disabilities. So again, finding listings for your educational consultants, advocacies within your local area. So again, if you're not within the Arapahoe or Douglas County catchment area, or Colorado, if you're in Colorado, reach out to us here at the Arapahoe Douglas. We'll connect you with whatever ARC chapter you might be, in your area. But let me go ahead and click on one of these. So let's go to FAPE. That's a fun, easy topic, right? So under IDEA, public schools are required to provide each child with a disability with a free and appropriate public education, or FAPE, in the least restrictive environment at no cost to the child's parents. So if they're pulling your kid out of classes and they're not allowed to do, like, free and appropriate education is a nutshell. It's a really big thing. So learn these things. Look into this. Here's the actual law. Like, here's the law under IDEA. You can go in and read about how FAPE works within your IEP, how, evaluations and testing, guidance on FAPE, and like how IEP goals must be aligned with the grade level within the regular standard. So it can't be below your standardized grade level at all the times. Like, if they're performing below grade level, they need to receive specialized instruction. That's part of FAPE. Here's some general questions and answers. So this website has a lot to it, a lot to unpack. So on a snowy day here in Colorado, when things look like we might be heading that way as we get colder, or when and if we're ever out of COVID and you want to sit down in front of a computer once again, this is a great website to come into and just click on for a little while and kind of navigate and read through it, because it gives you a lot of information of how best to support your loved one and the best way we can support you. So with that, thank you so much. That's the end of our presentation tonight. I'll go ahead and stop the recording and take any questions or anything. But again, thank you again if you are attended. This is recorded in the fall of 2020, and we'll go over next week the child waiver programs themselves and how do you actually, the requirements to get into them, what services they actually provide, and so that nuts and bolts of what really they come down to in the 4 child waivers here in the state of Colorado. Thank you so much and have a great evening.